Hi, it's Dr. Sarah Trunk here with Balance Within Physical Therapy. Today I wanted to talk all about why some people might still be having knee pain even after a knee replacement surgery. So we do see a fair amount of patients that we help out and do some fine-tuning with to really get them over the hump after they've had one of these surgeries. And that is a tough go for people. I mean, they get up the courage to do this surgery. They feel like things are improving, in those usually around the 6-week mark is when things start turning a corner and getting better. But some people may really run into difficulty getting range of motion back and not being able to straighten their knee all the way or bend it all the way. And others just might be feeling like, gosh, it's been, 8 or 10 weeks or longer and I'm still in a lot of pain or having a tough time sleeping at night. And then there's some that we see a few years later that are still having pain or symptoms, and either some of it never fully went away or maybe some of it's starting to come back and they're like, what is going on? Why is this happening? There are so many other pieces of the puzzle to having a healthy knee. And I'm not just talking about the joint, I'm talking about the muscles and the connective tissue too. And so usually if people still are having knee pain after a knee surgery, it's usually coming from the muscles and the connective tissue surrounding the joint itself. That is most often what's happening in those situations. So why could that be? Traditional knee replacements usually do create a lot of scar tissue. Some people, their body lays down more scar tissue than others. It's just how it is. Where our myofascial release specialty really comes in is loosening up stubborn scar tissue. It's so helpful and it's so gentle for doing that. So if that's a concern of yours, we can probably help you. Some other pieces that go into it is also the connective tissue and adhesions surrounding different muscles. So for example, the quadriceps muscles on the top of our thigh, the IT band and musculature on the side of our leg, those are all very common areas that tend to be really tight and bound up and restricted, especially if people's walking and their gait and their activity has been significantly diminished before a surgery. Oftentimes it's tightness in these areas that really drive the dysfunction and extra wear and tear that causes arthritis to begin with. And if that's not addressed, that's still going to cause discomfort in general in this region afterwards. So just something that still needs to be addressed, that's all. The other piece that we often see is what's going on in the rest of the body. So whenever we're treating a knee, we always are looking at what's happening in the foot and the ankle and even the great toe, as well as the hip and core and the back. Our whole body's connected, and our lower half especially really works together with our walking and our gait. And if something's off on one side or in a joint above or below, it's going to affect the whole system. So we really do look at the big picture with this too. So I know that's a lot of information, but at the end of the day, I just want you to know that if you or a loved one are still having pain despite going through a knee replacement surgery, that is fairly common to have that happen, and there's so much we can do about it to help. So if you'd like to schedule a free troubleshooting consult with us about residual knee pain or anything else going on, we do have a few of those we offer every month, and they do tend to go quick, but you're welcome to claim one of those at www.balancewithinpt.com, or you can email us at info@balancewithinpt.com. We'd be happy to have you pick our brain and be a resource to help you figure out where to go from here. Thanks so much for listening.